In clinic, when I see you, I will discuss with you the whole patient journey from when we list you for surgery, the time of your surgery, and also the post-operative recovery period. And a question I get asked quite often is, how long will it take me to get back to driving, get back to life? And I normally reply with, it takes you about 6 weeks to recover from the main surgical elements of your surgery, which is the wound needs to heal, your mobility needs to start improving. You may be off crutches or you may still be on crutches at 6 weeks. Everybody's slightly different. So, and that varies. But at 6 weeks, you should be on that trajectory and gradually getting better. Pain should be improving, mobility should be improving, and that's what I would normally see you again in the clinic. Sometime before you discharge from hospital, the physiotherapist may identify that you may be somebody who requires a little bit more help and assistance once you're discharged. And they may institute that for you whilst you're at home, or they may advise you to come in hospital on a few days within those 6 weeks for a bit of extra input when it comes to physiotherapy. So at 6 weeks, I assess you and make sure you're on that trajectory getting better. Then there's usually another 6 weeks after that, i.e. 12 weeks after your surgery, which equates to 3 months, where you will then start to really turn a corner and get to a bit more normality. I also say that it can take you about 12 to 18 months for your body to adjust to the new hip or new knee replacement. And that again is just how our bodies work, how we recover and how the scar tissue develops and how our muscles recover and improve over time. Prior to embarking on surgery, I do get the patients to meet with the physiotherapists or the occupational therapists, and they will make an assessment after discussion with yourself how your home is adapted for you after your surgery. Now, none of these adaptations necessarily need to be permanent, but some of these adaptations can involve having a raised toilet seat. It could mean that you have certain grabbers that you can use to pick up things as they fall rather than you bending down too far and putting your hip or your knee replacement at risk in the early days. It can also mean if you need any adaptations to, for example, get upstairs, if you need any handrails, and things like that. And overall, we find that most of these things are temporary because as patients recover and get back to normal, they do find that they don't need to depend or utilize these things as much. My aim would always be to try and get you back to your normal activities, be able to manage your day-to-day activities, your work duties, etc. My feeling is if you are able to engage with the post-operative rehabilitation, people find that their recovery is much, much better. If there's any delay in that rehabilitation input, or if patients do not engage with it, then I do find that their recovery can be a little bit delayed. It doesn't mean necessarily that they will not have a good outcome. It just means that they won't get there as quickly as maybe somebody else who has engaged with that rehabilitation. And that aspect of it really pays dividends for you in the future. If you've engaged with the rehabilitation, even before your operation, you've got your muscles into good tone, you've had your surgery, and afterwards you really engage with the physiotherapist and you're doing the rehabilitation, I do find that those patients do recover sooner and get back to life sooner. Some patients, because of other limitations, are unable to do that, and I do find that their recovery can be slightly delayed. But overall, if I was to look at everybody in a year or 18 months' time, I do expect them to be back to driving if that is what they want to do, back to going on holidays, playing with their grandchildren or their children and partaking in activities that they weren't able to do before, for example, if they need joint replacement surgery. So that is precisely the aim here, is to get the patient pain-free and then restore their function as a result. No longer than a day, maximum 2 days. That is down to the type of operation that we carry out in those patients, but also to do with the anesthetic that we provide and also the rehabilitation that we do afterwards as well. Every patient after the surgery will see a physiotherapist. They will get them up, they will get them mobilizing, they will teach them exercises, and depending on how they progress and proceed, then they will be allowed to go home safely. Now, once they're at home, I would expect them to do those same exercises and rehabilitation that they've learned in hospital. And that is what allows our patients to have the best outcome possible. I specialize in looking after people who have been multiply traumatized or polytrauma patients, and there is a cohort of patients within that group that can experience post-traumatic stress disorder. We've got a very great team, both in the NHS and also on the private side, who can evaluate our patients and assess what are their requirements and what are their needs. The care that we provide to patients who may have gone through a particularly traumatic event, we start their recovery from the mental health side of things at the time that we are treating their physical problems as well. So it's at the same time, we don't delay things. Because one thing that happens with a lot of these patients is that their bodies have gone through that physical trauma, but their minds and their brain is still catching up. And we do find that a lot of patients have delayed reactions to the trauma that they've experienced. And if you're not one who has seen that before or not used to dealing with that, then that can throw you as a clinician sometimes. So I'm afraid that's a definite myth. You can, if you've had joint replacement surgery, depending on certain parameters, that if you have enough bone stock, that you physically can withstand an operation, and if you're willing to go through with another operation. Whereas, some patients may have a joint replacement surgery that's not working well, but they just don't want to have another surgery, and that may stop you from operating on that person, which is absolutely fine. And so those are the things that we do look at, but certainly, and that's again one of my specialties as well, that if there are problems with anyone's joint replacements, be them in the hip or the knee, then we can certainly look to revise them if there is indication to do so. And there is a certain way of how we manage those patients, and there's a whole workup. Again, we discuss it with a multidisciplinary team, and then we plan the appropriate method of how we can remove the old implant and then put in the new implant. And there's a very specific way to do that. But primarily, osteoporosis means that your bones are getting weaker, and that usually occurs as one matures with age. And certainly there are things that you can reduce osteoporosis later on in life by making sure that in your younger age that you've put down enough bone and enough mineral content in your bone, and that could be by making sure you're doing enough weight-bearing activities like walking or physical exercise. I always say particularly women are more prone to developing osteoporosis, and that is more related to the hormones that women have, and also the age-related changes that they can undergo. And that is why there's also treatment and medication available to strengthen the bones as well. Also taking calcium or vitamin D, making sure you're getting enough sunlight. All of those things allow you to have more mineral content in your bones and put you in good stead for the future. One of my main hobbies is traveling. I really enjoy that. Experiencing new cultures, new architecture, just seeing what that particular area, location, region has to offer. I'm going to say that's an easy one, and that's cricket. I do enjoy playing cricket locally, but also going to watch it. and seeing it on the telly as well. I think it's definitely got to be cats for me. It's just that I seem to get along better with cats than dogs. That's an interesting one. I'm definitely right-handed, but there are many a times that I've had to, whilst I'm operating, use my left hand, obviously. And over time, you do become a little bit ambidextrous because we're operating on joints that are on the right and the left-hand side. I'd like to go with Ferrari. Not that I can afford one, but I would go with Ferrari more because it's a little bit more understated, a bit more subtle, just a little bit more classier. Mercedes, dependable, and I've got more experience driving a Mercedes than a BMW, so definitely Mercedes. Italian food. My wife loves Chinese, so we constantly chopping and changing. I've got to say, favorite dish is a difficult one because I've got a few, but I really enjoy lasagna, and that can be meat or veg, and that goes with anything really, or on its own. So definitely lasagna. It's really enjoyable. Thank you very much.